Right, okay, so I'm a social science researcher working in public mental health and currently working on dementia and long-term care in the STRIDE project. I'm presenting on behalf of a team who are my co-authors, and I'm going to give you a very brief look firstly at a SWOT analysis of the dementia situation in South Africa from the STRIDE project, which stands for Strengthening Responses to Dementia in Developing Countries, and specifically looking at the long-term care aspect of this analysis. And then briefly look at a few findings from a COVID-related survey of long-term care facilities we conducted in South Africa under the auspices of the STRIDE project. And this report has been published on the International Long-Term Care Policy Network website, ltccovid.org. And we're going to be updating that with the second wave of our survey. So briefly, the SWOT analysis. In terms of the strengths, firstly, there is a long-term care system in South Africa. It's basic, though. It is supported by subsidies from the Department of Social Development. And there is also a push to fund community-based care services. And there is also a system of registration with the Department of Social Development. And linked is also a strong faith-based and NGO sector that provides long-term care, and there are large organizations that do provide long-term care facilities. The weaknesses relate to the fact that the long-term care facilities, these are formal facilities, are largely private, urban bias, and expensive, and so not accessible to the majority of the people who would need it. There are only 8 long-term care facilities fully subsidized by government, and those would be targeting the most indigent older people. Subsidies that are provided are individual linked. So if the person dies or moves out of the facility loses that that subsidy, and that's been quite a crucial issue around during COVID as well. The funding for community-based services is slow in coming to the fore and being realized. And also there are very few registered facilities. Under 50% of them are registered, and that's something that needs to be looked at. There are very few dementia care facilities, especially in the public sector. The ones that do exist are largely in the private sector, and there's limited information on facilities. And as we've heard from both Isabella and Eleanor, the sector is highly gendered. There are opportunities, and Isabella showed that very nicely, about the visibility of that COVID has granted to long-term care, to the long-term care sector, and certainly highlighted the gaps and the weaknesses. There's a mapping of NGO facilities currently underway with an attempt to increase licensing. There is a redefinition of the housing regulations, which would allow for more than just a typical or the standard view of disability around mobility and sensory deficits, and an increased call for intersectoral work and networking, and looking at a potential to integrate the long-term care provision within the national health insurance that should be implemented in the next few years in South Africa. The threats are, firstly, to highlight what has already been said by Isabella and Elena, is the long-standing neglect of the long-term care sector, both at facility, community and home-based level, and both paid and unpaid. Also the vulnerability of older persons and long-term care workers, the shortage of long-term care workers, and the lack of training, which also limits career mobility for these people, and of course a lack of specialist training in gerontology generally. So moving on to this brief survey that we did in facilities, we used the network from the STRIDE project to disseminate surveys to facilities around South Africa. We did 2 rounds, one the end of May and one in mid-July. We got responses from 46 facilities. About 10 of them responded to both surveys. And you've got a bit of statistics here on the rates of infection, which don't seem overwhelming in themselves, but these are all reported by the 46 facilities, not confirmed in any other way. The bias of responses are due to the fact that we were able to get responses largely from the slightly better off facilities. So just some brief headline trends. Firstly, that the facilities face enormous challenges and frustrations, from inadequate government support, the financial crisis that this brought additional costs of PPE, loss of revenue from not being able to fill empty rooms, a number of human resources issues that arose, and long delays in providing information specifically from government. There were enormously innovative responses from all the facilities, showing a lot of adaptation and flexibility, especially in the face of poor official support. Health and well-being became a very strong theme in terms of maintaining the morale and well-being of families, residents, and staff. The importance of communication, especially between residents and their families, and there were talks of Zoom parties being arranged. A lot of in-house education and training took place to facilitate infection control and managing lockdown. And as I said earlier, an enormous amount of flexibility and adaptation. A number of dementia-specific issues arose, the impact of memory and comprehension issues. The sources of support were varied. Government support was patchy, although there were some really good instances of it, but there was a lot of really poor support. Personal faith seemed to play a big role in helping people cope with lockdown, and organizational head offices often developed policies in view of lack of formal government ones, so there was that support that came, and families and communities rallied as well. And everybody talked about the enormous dedication from the staff in these facilities, often being completely locked down, not seeing their families for up to 3 weeks or more. But there remains a number of unmet needs, the lack of finance and resources, and the loss of income that I mentioned, poor communication with official structures, the need for more recognition of staff and managers, and it's been very focused on healthcare staff, and maybe we need to also shift some of that to really publicly recognize long-term care workers. And the contact between families and residents was really a contentious issue and difficult to manage. So just my final slide, a couple of policy implications. Firstly, the long-term sector needs to be represented on the COVID-19 coordination and advisory bodies, and ensure that policies are developed that address the long-term care sector directly, to coordinate efforts between specifically health and social development, and also the formal recognition and professionalizing of the caregiver sector, and such as developing a caregiver register and accredited training. And also showing that this unprecedented crisis does require flexibility and adaptability. And I think to be important to hear the voices of home-based carers and to develop innovative strategies, and also to balance infection control and emotional well-being, and to recognize the role of religious faith in keeping going. So those are just very brief points, and I hand over to the chair. Thank you.
Thank you, Marguerite. It really is bringing a lot of very important questions to the front. And we have one question here. If you can maybe try and keep the answer a bit short, but you can still use the Q&A box if you need to elaborate a little bit more, because I think it is a question that could last with an answer that could last for quite a while. It's a very good one. Is there any observation that can be made about the long-term impact of COVID on the needs of people needing long-term care? So I think it cuts across many of the things we've heard from the previous presentation. So from your work there, can you?
You know, I think it's, I'm not sure I can answer that very well, but maybe to look at strategies to really find ways of ensuring that communication happens. Yeah, and to yeah, I'm not sure if that. Sorry,
It's a big question.
Yes, yeah, no,
big question.
I think the highlighting that COVID has brought of the long-term care sector and the gaps that do exist is probably one of the key issues that will hopefully have an impact on making long-term care more visible and the impact. And I think the points that Eleanor raised around the financial aspects, and you know, you can't just say, oh, you know, well, let's just let older people die because they don't contribute, is clearly a false assumption to make. And I think to really bring all of that together. But sorry, that's not a very good response. But
no, it does capture the complexity of the challenge and the fact that we're highlighting the gaps in long-term care for a lot of people who really would need it but just can't access it.
Yeah.
Okay, thank you very much for your presentation.